Good morning, everyone.
Good morning.
How is everyone today? We're so excited to be here. This is just like an awesome place. It's great to be back from COVID. It's great to meet so many of you. All year we get started. We're working on building the program. We're reaching out to companies. We're reaching out to universities. We're meeting students at career fairs. Like every year it starts out as this pipe dream. We're like trying to get the program started and getting it going. And then it's always stressful in the fall and into the spring. And we are able to place some students into internships. And we're now in the 6th year of the program, and we couldn't be more happy to be here and to welcome you all here. We've got a great 2 days scheduled. And I should say, my name is Richard Robbins. Our company is called Upper West Strategies. We run the program, which I guess all of you know. We run the LifeSci NYC Internship program on behalf of the New York City Economic Development Corporation. I want to do quick intros of the team, and I think people are scattered around. I was going to start with Sharon, who's hiding in the corner. There's Sharon. Anita is our strategic consultant, who's the mastermind both behind the program and behind boot camp. And we're really excited she's here. I see Sally's over here. Evan. Bill is over there hiding. And Nidara's here. So if anyone needs anything at all, just let us know. We're happy to help out in any way possible. We've got a great day planned. I hope all of you are coming tonight. We're really, really excited. We're doing the kickoff tonight in the Hall of the Universe at the Museum of Natural History, which should be incredible. So we're going to start off with Anita talking about life sciences and what it all means. And Miko from the New York City Economic Development Corporation is going to be doing an intro. And then I'm not going to go through the whole schedule for today, but it's, as always, a great day scheduled. A few housekeeping things. Everyone, I think, who wants it has found the coffee, but if you haven't, it's in the kitchen down the hall. Restrooms and also water bottle filling stations are to the right. We always welcome people to come closer. I know we're still post-COVID and people are staying further away, but we're friendly. So feel free to fill up the front.
Please fill up the front because we will need to use the back tables for next week later, so come on over. Thank you.
Anyone else have any announcements? Does anyone have questions? Everyone excited for a full day of activities and a party tonight? Great.
Thank you, Rich. Welcome, everybody. Thank you for being here bright and early. I hope you got a little breakfast, and coffee, water, and I wanted to first welcome you because you made the cut. You may not know that there are over 2,000 applications for this program. We don't wish to be so exclusive, but it is really competitive. You made it. So congratulate yourself. Let's give yourselves a round of applause for getting through the application process, for showing up here today. This is voluntary. I hope that you're gonna learn, feel, do a couple of things over the next couple of days. I hope that you learn just a little bit about what life sciences means in New York City. It is not just pharma. It is not just biotech. It's also digital health. It's a lot of things. I'll go into that in a little bit. I hope that you'll see that there are so many companies here in New York City, and this is just the list of hosts for this year. We always have a dynamic list of hosts who come and work with us. I hope that you see your logo here. If you do not, please let us know and we will correct our mistake. But I believe everyone's host company should be up here. What else? I hope that you learn a little bit about the life sciences landscape. By the end of these next 2 days, I hope that you feel a little more connected to some of the people here in this room. Maybe because some of a connection in common, maybe because you're working at the same place, maybe because you just have the same hobbies, or you're a huge Swiftie, or you went to Coachella, I don't know. But whatever it is, I hope that you maybe get to know a couple of people here because this is your network. We will talk more formally about networking later today, but the intention behind boot camp is to recognize that you all are the future leaders of life sciences, digital health in New York City. So we want you all to know each other because I'm going to be calling on you for a job in a couple of years when I'm going to be looking for folks to help me out. So you might be wondering, who am I and why am I even qualified to share anything with you? I'll tell you a little bit about my background. So Anita Kishore, I'm an executive and career coach. I'm based here in New York City. I'm based in Jackson Heights. Any Queens folk here? Yes, quiet Queens love here going on. And we could just do a quick check by hands of borough representation. Anyone here from Manhattan? Lots. How about Brooklyn? Always the Brooklyn love. And Staten Island? Yes, yes, I love it. We even now have partners represented from all 5 boroughs as well. Is there anybody here who is not from New York City but maybe is attending college? Oh. Talk about a Queens bias. Whoops. How about the Bronx? Y'all gotta call me out on this stuff. Thank you, Sharon, for doing that. And I invite you honest. Yes, and I invite you all to do that today. So actually, that is something that I like to do when I do workshops with folks. I like to, before sharing all this story, I want you to feel comfortable. I want you to feel safe. I want you to feel that this is a place where you can learn. So I'm not going to formally write up any rules or guidelines, but I do want to recommend. I ask that you speak and listen, and try to show respect to your fellow classmates, if they're or colleagues, as we're going to be, as we are now. And there are going to be some activities where we're going to, like small groups, get to know each other, some team building stuff. But if you have questions, I hope that you will feel comfortable asking them, raising them. You can raise your hand, ask out loud, or if there's something that you want to ask any of us in a one-on-one, please feel free to come grab us during the break. We want you to feel welcome, comfortable, and want you to learn. Okay, so back to this. Who am I? Why am I up here talking to you? So that's me in kindergarten. I was taken shortly after I had just come back from India, and my mom cut my hair. She's not a hairstylist, so we all have those like 5-year-old pictures with our fun, interesting hairstyles. So I was born and raised in the Midwest. I grew up in Kansas, and my family is from India. I had just come back from my first trip from India, and I remember being sitting there in the car on the way back from the airport, like nose pressed up against the window, wondering what's going on, just taking it all in. But I remember stopping at the stoplight and seeing little girls who looked like me, but they were naked and their mothers were begging for money at the stoplight. Didn't make any sense to me. I didn't understand poverty, I didn't understand development, I didn't understand economics. I just thought, well, those kids must be sick, so maybe I need to help them. That was what went through my 5-year-old brain. I thought maybe I should help them get medicines. It wasn't a completely strange idea because my parents are physicians. I had medicines whenever I wanted it, so it kind of made sense to me. That's what I decided anyway. So I decided, not in these such formal words, but I decided that I wanted to help little girls in poor countries get access to medicines. So then I decided, I guess, how do I do that? I have no idea, but I'm going to major in chemistry. So I went to Yale University. That's me, my last day of my senior year. That's my grandfather when he was still alive. He got to see Yale. It was really fun. I gave my whole family a tour, and that was my lab. That's my column. At Yale, I studied photosystem 2 under Gary Grudvig, doing biophysics research, biophysical chemistry research. I was studying the properties, calcium binding properties of photosystem 2 using a calcium-sensitive electrode. I'm amazed I still remember that. I was looking at both spinach as well as cyanobacteria. I kind of liked research, but I wasn't sure if it was for me. So I applied to a Rotary Scholarship, went to Australia, and worked at the University of Melbourne. I got a master's in 1 year. That's actually Sydney. That's my parents joining me for a tour of Australia and New Zealand. And I studied the tensile strength properties of native Australian spider silk using solid state NMR. Any NMR spectroscopists in the house? Maybe not, that's okay. It's a very, very niche, thanks Rich, a very niche field. So I got familiar with this technology. My supervisor was great. She let me travel all throughout Australia, give presentations. And by the time I came back to the US, I had really caught the research bug, and I said, I really want to get a PhD. So that's me atop a high-field NMR spectrometer at the University of Georgia, Athens, Georgia. If you're a football fan, national champions 2 years in a row. And this is a $5 million magnet. I was very lucky to get the chance to use it. But in my first week in my PhD, I learned that 80% of PhDs don't stay in academia. So that only means 20% of PhDs stay in academia. By the way, guess what? Today, this is in life sciences, the figure is 93% of life sciences PhDs leave academia, which means only 7% of life sciences PhDs stay in academia. Shoot, what the heck am I gonna do with my life? I knew I was pretty smart, but I wasn't quite sure if I was like top 20%. So I said, well, I gotta figure out what I'm gonna do with my life. So I spent a lot of time talking to people. I talked to anybody who had a PhD in science who wasn't doing academic research. So that meant industry, it meant government research, it meant pharma, it meant science policy, science writing, it meant patent law, and management consulting. And eventually, 5 years later, after I defended my PhD, I got a job in management consulting. So that's sailing on the San Francisco Bay. I was at Bain & Company in the San Francisco office. I was in San Francisco as well as Munich. I'm hiding over there behind the gauges, with a very weird hat on my head. And then at Bain & Company, as a management consultant, I mostly worked in pharmaceuticals, learning how how a drug goes from a concept in the lab to a commercially marketed drug. So I did something called what's called portfolio management. Actually, yeah, at Bain I did a lot of work with pharma companies, learning how the pharmaceutical FDA drug approval cycle works, and worked there. I worked in Europe, and upon the time I was about to get promoted, I said, I don't really want to be a career consultant. So I said, okay, what am I going to do? A headhunter came and called. This is something that's a very cool thing that happens at some point in your career, especially when you're on LinkedIn. Shout out to Rich for tomorrow afternoon. He's going to give a little presentation on how to rock your LinkedIn profile. Some of you may already have a LinkedIn profile, but he's going to give you some great tips. So a recruiter found me on LinkedIn and said, hey, would you want to come work at Sandoz? Sandoz happened to be the #2 generic pharmaceutical company in the entire world, headquartered in Munich. I had just been living in Munich with Bain. I had friends there, and it's a really great company to work for. It's a division of Novartis. So I moved back to Munich, and that's me with my team. I don't know why they put me in the middle, but that was our strategy team. I also ran something called RxGX, which is helping bring Sandoz's generic pharmaceutical products into Novartis so that we could launch earlier, faster, and save money for patients. Highly aligned with what I wanted to do, access to affordable medicines for patients worldwide. I loved it, I had a great time, but I wanted to come back to the US. I didn't want to be living in Germany for forever. I went to Oktoberfest, I don't know, like 5, 6 times. I have multiple dirndls, which is, the outfit. It was fantastic. If you get a chance to live, work, study abroad, I highly recommend it. Do it especially while you don't have a spouse or a partner or kids. It's a lot easier to do it, but if you do have a spouse or partner or kids, try to convince them. And if you have any questions about living or working abroad, let me know. Let me see what I put next. Oops, that's the wrong way. Okay, so I also, that's not where my story ends. My story keeps going in terms of, I didn't want to be in Princeton at some point, so I moved back from Sandoz. I was in Germany, I moved to Princeton. I still have a Princeton number, but I guess I'm a New Yorker at heart because I could not live in Princeton for very long. So I moved to Princeton, was living not far from here, actually just a couple of blocks down in Chelsea, and LinkedIn happened once again. A TA of mine from undergrad found me on LinkedIn and said, "Hey Anita, how's it going?" And I said, "Oh, look at that, you're a VP at Pfizer? Tell me more. You live in New York? What's going on?" About 3 months later, I had a job offer as a senior director of strategy and innovation. So I joined Pfizer, 42nd Street, really awesome. I remember once seeing the Yankees ticker tape parade. I'm not actually a Yankees fan, but you know, it was kind of cool seeing the parade. Unfortunately, that job didn't quite work out as well as I had hoped. Less than a year after I started, within about 8 months, a couple things happened. I was not getting along very well with my boss. We mutually agreed that I would find another role in the organization, and I did. On Friday, I got a phone call. "Hey Anita, congratulations, you've got a new job." Saturday, I saw on the news that Pfizer had announced a corporate restructuring. Monday morning, yet another phone call. "Hey Anita, sorry, take backs. I didn't have the job anymore." So sometimes things just don't quite work out as you plan. So in that time, I ended up leaving the company. I was kind of underemployed for a little while. I got much more into career coaching. I work as a career coach with MLT, Management Leadership for Tomorrow. I mostly coach underrepresented minorities who are in business school. I then, a few years ago, added executive coaching to the repertoire. And one fine day, Rich and I happened to be sitting in a meeting at the New York City EDC. We were both the nerds sitting in the front row. Rich was on his computer, taking a lot of notes. I sit in the front row because I fall asleep if I don't sit in the front row. But we were the nerds in the front row. We met, we started talking, and we said, "Hey, I think we could do this internship thing." Rich has a lot of experience in running internship programs in New York City. I have the life sciences experience, and I've been coaching for several years. So we teamed up. 6 years later, we're still here, so I hope we're doing something right. We have a community of over 600 interns who've been placed in positions across New York City. You are part of that community now, so welcome. So I just hope that you'll see, and you'll hear a lot about different people's career stories as we go through the next day and a half. Please ask questions. Not just of me, but of our speakers. I hope that you're inspired by them. A lot of people say, "You know, Anita, by the end of these, I realize that the career path is not linear." I hope you get that experience as well. You can do a lot of different things, and let's see what some of those things might be. Helps if I go the right way. So what does life sciences mean? So when I say you're part of the LifeSci NYC Internship program, what do you guys think what life sciences means? Any brave soul willing to raise their hand and share what you think, what it means to you? I might call on Stefan. You've been through this before.
For me, life sciences mean the entire community. It's very urban for me because it's right here in New York City, and that basically is not just the environment, but the social community as well.
Nice community. I love that. Anybody else want to give Stefan a little comfort so he's not the only one speaking out? Udar.
Anything living? Anything dealing with anything living?
Sorry.
Anything dealing with any non-living or
Anything dealing with anything that is living. Okay. One more. Thank you. Yeah, anything that can improve the health or well-being of people's lives. So, in New York City, life sciences means a lot of things. It means all of the things that you all just discussed. It's pharmaceuticals, and we have a huge pharmaceutical company in New York City, Pfizer, in case you didn't know, on 42nd Street, going to move to Hudson Yards soon. We also have a lot of smaller startup pharmaceutical companies, including companies right here at IndieBio, which we'll get a tour of later. Life sciences also means medical equipment, diagnostics, technology. I think several of you are working at technology companies. It also means digital health. I'm not sure if any of you are familiar with what digital health is, but New York City is one of the biggest hubs in the world for digital health. It's still dwarfed a bit by the West Coast, but there's always a ton of investment in New York City digital health. What is digital health? It could be as simple as your Fitbit or your Apple Watch, that division of some of these companies tracking your data, but that's more on the consumer side. It also has a whole lot of things. You probably can't really read this too well, but this is some data from a consulting firm called CV Insights. It's a whole area of digital health that has lots of subcategories. Care delivery and navigation technology, monitoring, imaging, diagnostics tech, drug R&D tech, health data and analytics, digital therapeutics and wellness, health insurance, digital pharmacy. So there's a lot that's happening in the space of digital health. Lastly, health is really a connected system, and it takes funding, it takes intellectual property, it takes banks, it takes a whole ecosystem to actually make it work. And we are very lucky in New York City that we actually have the entire ecosystem to support life sciences. But of course, at the center of all of it is a patient. So I hope that you can keep that in mind in the work that you're doing. Although I know many of you are working in areas that might be slightly adjacent to life sciences. It might be more related to life sciences. Increasingly, the last panel that we'll have tomorrow is going to be about health equity, global health, health in New York City, public health. And you may have heard of the social determinants of health. These are factors that are not necessarily about biochemistry or physics, but maybe about the social, ethical, or other components that make up a healthy lifestyle. Just to give you, is anybody working for a digital health company here? I didn't see, I wasn't sure that
There's
you were.
idea.
Say it again? Yeah, I couldn't remember exactly which ones, but I just wanted to share, I shared that, I mentioned that digital health is really big in New York City, second to just the Bay Area. And just to give you a sense of what it means, because this is a fast-growing area, although right now, Q1 2023, Q2 2023, investment is slowed a little bit because of the economy. You can just see that there's so many areas, right? Insurance, mental health, women's health. A lot is happening in women's health in New York City. Patient engagement, virtual care and coordination, analytics and insights, provider enablement. For any of you who are working for physicians or hospitals this summer, you may see digital health. People may not even realize what they're doing is digital health. But anytime they are collecting data, analyzing data, sharing data, that's considered digital health. So the last thing I want to do before we move into some activities is just share with you a little bit about life sciences or not just what it is, but just to start thinking about the meaning and implications of some of the things that we do. So on the far left, that's a vial of Zolgensma, the most expensive drug in the world from Novartis, costs $2 million per patient. Is that fair? Is that just? At the same time, next to it is a vial of, but I'm forgetting what it is. It's not Paxlovid, but it is another drug that was developed by Gilead, Remdesivir. And that was used during COVID. It was another life-saving drug, but it was priced priced at about $5,000 for 5 days of therapy. Helped a lot of people, but guess what? It avoided the cost of being in a hospital for 5 days. So this is what's called health economics outcomes research. So is it worth $5,000 if it avoids $20,000+ worth of a hospital stay? Any economist would probably tell you yes.
What is the most expensive drug treatment?
I don't remember what it is for. I will have to get back to you on that. Great question. I think it is a rare disease, but I'll get back to you on that one. Oh, it's gene therapy. That's what it is. So gene therapy is a newer muscular dystrophy. Maybe. Okay. Love it. We can learn from you, all of us here. So the price of drugs is something that we're not really, we may not address directly in your internship, but I just want to put some ideas in your mind. These are some of the problems that, as life scientists, as people working in this space, that we may face, that we may wrestle with. So the price of drugs. On the far right, some of you may have heard that mammography, breast cancer detection, the age for starting detection has lowered now from 50 to 40. Is that a good thing? Is that a bad thing? People are debating this. But even if there may be some false positives along the way, if it can help people get treatment earlier, save lives, maybe that's worth it. But then on the bottom, we also have some interesting complications to life sciences. Elizabeth Holmes founded Theranos. She just got hit with a $435 million, maybe it was well over $400 million fine, and she's about to go to jail on May 30th for defrauding investors. And there are also lawsuits that are happening and settlements between Walgreens and the patients who got false information. So there are ethical responsibilities to starting a company, to being an entrepreneur. And in the middle, worryingly, Tony Fauci, Dr. Fauci, the head of National Institutes of Health, Allergy and Infectious Disease Institute, the face of COVID, right? He's being subpoenaed on a very regular basis, actually by a friend of mine, not by a friend of mine, but a friend of mine works for the Department of Justice and is defending Fauci and a number of other administrators in the Biden administration because, on the far right, attorneys general from Louisiana and Missouri are suing members of the Biden administration for First Amendment right infringement. So you may remember that during they're claiming that the government shut down free speech from big tech, social media during the time of the pandemic. What's scary about this is, does the public still trust science? Do we have the ability of scientists to actually speak out? I don't know. Right? This is all being debated, this is all being decided. You don't have to solve any of this week, but I just wanted to share with you just some of the additional considerations. It's not just about the science or the engineering. Do well at that this summer, but also pay attention to some of the other issues that are going on in the background.
Anita,
Yes.
thanks to Google, Zolgensma received FDA approval in May of 2019. It's approved to treat spinal muscular atrophy, a rare childhood disorder that causes muscular erosion that can lead to lung infections and muscle weakness. A one-time curative therapy, and 8 children have been treated with the drug showed no sign of the disease. That's $2.125 million. There's also another drug that was more recently approved, hemophilia B gene therapy, Hemgenix, which is a one-off infusion that costs $3.5 million a dose.
Hard to say, it's very expensive. But if it is the only life-saving therapy, again, we're not going to answer these questions today, but these may be questions that you're going to be wrestling with over your internship or your career. So what can you do to stay in touch? How do you keep learning about life sciences? yes, you've got your internship, you've got your community here. These are just some great places that I recommend that you follow. You can subscribe to any of these newsletters, Fierce Pharma, Fierce Biotech, Endpoints News, Stat News. Yes, feel free to take pictures of this. New York Bio, I think we have a lovely intern who's going to be working there. Great place. Also in New York City, Digital Health New York. Bunny Ellerin has started this organization, and they do really great research and reports. And she often utilizes the work and intelligence of people, of students in New York to write the quarterly papers that she produces. So great places to just keep learning about life science.